Hi, my name is Kyle, and I am a physical therapist assistant, strength and conditioning specialist, and certified personal trainer. And I'm here to talk to you all about ankle, knee, and hip stability, or the instability that you might be suffering from. This instability could be showing itself through, flopping around when you're walking. You just feel like your legs and knees and all this stuff just really aren't moving as well as they could. You may have symptoms where your knees cave in or a valgus. You may have an overpronation at the foot, or you could even have some snapping IT band or hip impingement, things of that nature. And these can be annoying. It's not that they're necessarily a bad thing, but they become a problem when they become a problem, right? So my goal today is really to define why this may be occurring, as well as give you a routine of a couple exercises that you can try out that hopefully will improve your stability all the way up through the lower extremity, or even a specific area such as the ankle, the knee, or the hip. So first we need to talk about the definition of stability. When we think of stability, it's this object that is able to resist a change. But when we use this term in comparison to the human body, it doesn't necessarily work too well. And I say this because the human body is meant to change, it's meant to move in all types of different ways. So using the term stability, especially about a specific joint, means we don't necessarily want it to move very much. And that's not the case. We can all agree that if a joint isn't moving too well, that bad things tend to happen. So I don't care if you use the term stability so much, but I want you to think that we're trying to get a joint to maintain more control versus stabilizing it to maintain a specific position. Knees are meant to bend, hips are meant to rotate, ankles are meant to dorsiflex and plantar flex. This is all normal motion. It can just be a problem when it may happen just a little too much, or you don't have the specific control over the motion that you have available. So why is it that the ankle, knee, or hip, or a combination of all the joints are unstable, or you're not able to have as much control over them as you would like? The normal school of thought in terms of whatever type of health, fitness, or rehab practitioner that you're talking to, they'll probably say, hey, it's just because these muscles are weak. So if we had to use knee valgus for an example, when someone's running, jumping, or maybe even walking, their knees are caving inward toward each other. And we could pick on a muscle group such as the glute medius to say, hey, that muscle is weak. So we need to strengthen it so that way we can stabilize at the knee joint better. And that can work in some cases, but many of times we won't have the same carryover of strengthening that muscle and actually seeing an improvement in a dynamic context such as the running, the jumping, or even the walking. Now, I did this personally for a long time for my clients, my patients, even myself, where I was saying, hey, let's just strengthen these muscles up. Let's just take a shotgun approach and see if we can make all this stick. And it worked in some cases, but it was pretty hit or miss. It's because we weren't really going after the root problem, which was the position of our joints and our larger skeletal structures. So the reason I found that the ankles, the knees, and the hips may be unstable, they may cave in, or they may kind of flop around, is due to a poor positioning in relation to gravity. Essentially, our posture is leaning so far forward that we're unable to manage any more forward translation of our body. So this will prevent muscles such as the glute med and the knee valgus example from having as much leverage as it potentially could in order to control the knee joint and caving inward. So if the body is falling forward and it's biased in that position, everything tends to collapse inward and together. So that means in terms of intervention, we need to first bring back the body in relation to gravity, reorient the pelvis and the rib cage, as well as some joints that are going to come along with that. So that way these strengthening exercises that you might already be doing can actually work out a little bit better due to the muscles being in a better position and gaining more leverage over the joints they control. So we'll be starting with some repositioning exercises or breathing exercises that will reorient the pelvis and the rib cage, as well as the rest of the skeletal structure in line with gravity. And then we'll follow it up with some strengthening exercises, specifically more co-contractions, which is a concept I got from David Gray. If you made it this far, please check out the links in the description. I have a full written out blog of this routine, as well as a bunch of other free stuff such as an anterior pelvic tilt ebook and a free 20-minute posture and movement assessment that I can do with you via Zoom. And I'd really appreciate it if you give this video a like, a comment, or share this with someone that you may know who suffers from these instability issues. This first exercise is the foam roller low back decompression. What you'll do is take a foam roller, it doesn't matter if it's a smaller one or a larger one. You're gonna place it at the top of the hips just below the low back muscle. Your upper body is going to be on the floor while the hips stay on the foam roller. And then we're just gonna use this positioning to stretch out the low back. So you'll bring the knees toward the chest, nice and easy, just like you see here. And we're going to exhale everything out through the mouth or the nose if you really feel like it. And then hold the knees toward the chest while you then begin to inhale through the nose. And you should feel a nice low back stretch. Now, I will warn with this exercise, though there's really nothing you can mess up, If you do suffer from chronic low back pain that is worsened by flexion, then I would hesitate to do this exercise and double check with a local PT or your doctor. That said, we'll utilize this exercise to decompress the back, which can be pushing us forward in relation to gravity, thus causing us to collapse or have that unstable or unsteadiness at the lower extremities. We'll do 3 rounds of 5 deep breaths and maintaining the pause after the exhale for 3 to 5 seconds before taking the next inhale. Now, if you're feeling good with that exercise and you're getting a nice low back stretch, but you want to progress it a little bit, you can do this exercise as sort of a Thomas stretch. And we'll go after the hip flexors, which can also pull the pelvis forward, along with the low back muscles pushing the pelvis and the rest of the body forward in relation to gravity. So you'll simply just assume the initial low back decompression, hold one knee to the chest, and then drop the other leg straight out into hip extension. You'll then complete 2 rounds of 5 breaths or 3 rounds of 5 breaths, again focusing on the same sequencing. The next exercise in the routine is the alternating starfish. You'll just start by laying on your back nice and comfortable with a hand towel or something of that size underneath your low back. This is just going to fill the space of where your low back arch is, just to maintain a relatively neutral spine. You're then going to position your arms and legs out at 45-degree angles away from the head or out at the hips. You'll inhale, and then on the exhale, you'll reach your opposite hand and foot toward each other. You'll gently inhale while maintaining that position to feel some expansion throughout the rib cage and maybe even into the low back. And then you'll exhale and bring your hand and foot away from each other. You'll inhale at the bottom in the open starfish position, and then you'll begin the sequence again by exhaling, taking your opposite hand and foot toward each other, inhaling on the hold, and then exhaling on the way down. You should be feeling obliques kick in big time with this exercise. And what we're trying to do is improve hip internal rotation while also working on maintaining the position at the hips in order to bring your center of gravity backwards in space. One of the biggest mistakes we'll see with this exercise is lifting the head or the upper thoracic region of the spine off the ground. So you'll see as I reach up here, I'm reaching just way too far. My head's lifting up, so I'm going to use my SCM muscles or sternocleidomastoids, as well as some pecs to essentially make this movement happen. Another common mistake we'll see is reaching and bending the knee too much. We want to really keep that knee as straight as possible and the head down nice and relaxed. And you'll also see some combination of the two where the knee is way too bent and where you're lifting your head and your shoulder off the ground at the same time. So now that we've repositioned the rib cage and the pelvis to go backwards in relation to gravity, we're now going to add a strength component while simultaneously adding some semblance of some repositioning. So you're going to start on your back with a foam roller underneath both of the feet. You'll then bridge up with both feet and then take one leg off. You'll then bring that opposite leg, in this case the left leg, up to about 90-degree angle, and then reach the opposite arm, in this case the right arm, up toward the ceiling. We'll then just maintain this positioning, thinking about keeping your heel here, my right heel, up off the ground as far as I can, sort of doing a heel raise, and just breathe, stay as relaxed as possible, but it's pretty intense. The goal of this activity is to create a co-contraction between the glute, the hamstring, and the calf in order to maintain this new pelvic position while simultaneously strengthening in an isometric fashion all these muscles together, going toward hip extension. We'll be maintaining this isometric on each side for anywhere between 15 to 30 seconds for 3 rounds. Things to watch out for are just not being able to maintain this position so your hips won't come up off the ground or your heel will sink down toward the floor. So if you're having trouble with either of these things, so what you can simply do is just use both legs instead of one leg, maintaining a bridge off the floor, the heels up, and then you could even add some heel raises, nice and easy, to get a bit more of that contraction happening at the calf. You can do this just holding for 3 rounds of 15 to 30 seconds or 3 rounds of 10 to 15 reps of calf raises. Now we're going to get you standing up and utilizing some of these muscles that we just activated with the foam roller bridge. So you'll need a foam roller and you're going to place it on the inside of the knee and assume a split stance positioning. So my back foot isn't very far behind me like a lunge, but it's more, say, 1 to 2 steps just behind the front foot. Now, while maintaining this position and the knee against the foam roller, you're then going to reach down your opposite arm toward the opposite foot or toward the leg that's holding the foam roller. As you reach down, you'll squat your hips down
toward the floor, and maintain the weight through the heel of the foot that's holding the foam roller. You should really feel some glute and inner thigh or adductor kicking in with this exercise. We can even add a weight, say a kettlebell or a dumbbell on that opposite hand, in order to get back into that hip and work the muscles a bit more. You'll complete 3 sets of 10 to 15 reps on each side. Some common mistakes we'll see with this exercise are not maintaining the foot placement. So you'll see people try to treat this almost as a reverse lunge. And in doing so, they may hinge a bit too much at the hips versus squatting down. You can also see an over rotation. So in this case, the sternum is pointing just way too far over. And lastly, you may see someone try to hinge way too far forward versus squatting down with this exercise. And for the last part of this routine, we will be doing a more dynamic standing activity, such as this front foot elevated reverse lunge. So what you'll need are some books or cork yoga blocks, work really well, but something about 4 to 6 inches in height. You'll then reach the opposite arm out in front. So in this case, it's going to be my right arm out in front, and then I'll be lunging back with the left leg on the blocks. So again, this is an exercise. We can also add some weight. So you'll do a front rack hold on the same side you're lunging back. I'm lunging back with the left leg on the blocks, and I'll have the weight in a front rack position on the left side with the right arm reaching. You should maintain most of your weight through the heel throughout the exercise, but you'll probably notice how your weight will shift from the ball of the foot as you step back toward the heel more so. We'll knock out 3 sets of 10 to 15 reps on each side. Some common mistakes we'll see with this exercise are, as you step back, you go just a little too far and you actually extend the back way too much and you get off balance. Another mistake we'll see is stepping off more to the side at say a 45-degree angle versus directly back. And lastly, we'll also see trying to use momentum to step up, in which you'll lunge that knee forward and try to use the low back to throw yourself up onto the blocks. Thank you all so much for watching this video. Please remember to like, comment, and subscribe, as it really helps the YouTube algorithm. And make sure to check out the full blog post so that way you can follow along with these exercises. Link down in the description.